All right, welcome back to Sinaba Stadium. That's where we're still coming to you live today. Commemoration of World AIDS Day. South Africa, here in South Africa, there are about 7 million people or more that are living with the virus. And like I said earlier on, that the statistics are shocking because there are about more than 2,000 new infections every week here in South Africa, and it's amongst the young women between the ages of 15 and 24. But let me just bring the Minister of Health into the conversation to look as to how far South Africa has come in terms of the fight against HIV and AIDS. Minister Motsoaledi, good morning to you and welcome to Morning Live.
Good morning, Palisa, and good morning to the viewers out there.
Thank you so much for your time, Minister. Just before we get into the actual perspective, talk to us about the purpose of this day.
Well, as you know, it's the World AIDS Day. All over the world, we are reflecting back on this very deadly virus. How far are we from eliminating it? How much work have we done? What is left? What is the way forward?
All right, let us now reflect back here, bring it home here to South Africa. I mentioned earlier on there are about 7 million people living with the virus. How far has South Africa come in terms of the fight against HIV and AIDS?
Indeed, that 7 million is a very high number, is the highest in the world. But also equally, as you know, we have got the biggest treatment program. It means we have matched the size of the epidemic, the burden, we have matched it with action. And that's why the 3.5 million people who are on treatment constitute more than 20% of the global program, making South Africa to have the biggest ARV program in the whole world.
Yeah. And I believe, Minister, that the numbers would even go up, would get to see the numbers moving up from that 3.5 million people who are on treatment, because earlier this year you announced that test and treat campaign, whereby you're saying that immediately when you get diagnosed, they just want to put you on treatment. Indeed,
and we've started that in September, by the way. When I announced it, it was in May during my budget speech in Parliament, but in September we started, and that's what we are doing now, and it's going on very well, whereby any South African who presents themselves to test, to get to know their status on HIV, immediately they test positive. We don't wait, we put them on treatment, unlike in the past where we now had to calculate the CD4 count and say if it is between this at this level we start treatment, if it's still above that level we don't do treatment. Now that's gone. It's test and treat. You test, you are positive, you go right on ARVs. And so that will bring more people than the 3.5 million who are already on treatment.
Right. And I do know that your department also launched a voluntary campaign of testing and counseling. How has the campaign done?
Well, the one before that was called VCT, voluntary counseling and testing, as you know. That has been abandoned in 2010. In favor of ACT, meaning HIV counseling and testing, no longer voluntary. Because the word voluntary was denoting people who know. You can only volunteer if you know. If you don't know that there is something like that, you can't volunteer. So it was supplier driven, this HCT. In other words, we go to people and ask them if they can test, unlike waiting for them to come and volunteer. And that's why we're able to reach 18 million South Africans within a period of 18 months since 2010. But after that, every year, we've got about 10 million South Africans testing and knowing their status. But as you know, in the International AIDS Society Conference, which was held in Melbourne, in Australia, in July 2014, we adopted the 90-90 strategy, meaning that we need to test 90% of the people who are vulnerable and put 90% of those who test positive on treatment, and 90% of those who are on treatment must find to be virally suppressed. Now, we are also on that journey. As you know, it's a very long journey and a very tough one, but we have agreed to embark on it. We have even done an investment case which we have presented to Treasury, and we think that is the way to go.
Right. Talking about the 90-90, I believe, Minister, that's why we have like 90 balloons, 93 times 90 balloons that are here, and you'll be releasing them matching what you've just mentioned to us now.
Yes, it is to signify that we have adopted and are dedicated to the 90-90. That's why we are going to release 3 bundles of balloons, 90-90-90, denoting that strategy. Remember, we said that strategy is the one that will take the world to 2030 to declare that HIV/AIDS is no more. We can only declare that if 90% of the people who are on treatment are virally suppressed. Precisely because when 90% of people are virally suppressed, it means the virus can no longer be propagated. It can no longer be taken from one person to the other.
All right, I'm going to let you go, Minister, to go and release those 90 balloons. I beg your pardon, like the Minister said, 3 sets of 90 balloons. Minister, you may go and release those balloons. Minister of Health here in South Africa, Dr. Aaron Motsoaledi, talking to us about the status of HIV and AIDS here in South Africa. More than 7 million are living with the epidemic or the pandemic here. 2,000 new infections every week. South Africa standing on the first position here in the world with the highest number of HIV prevalence. And we do know that we're rating on the 3rd place in terms of the prevalence of tuberculosis. There you have it on your screen. The minister is about to release the 3 sets of 90 balloons. There you are. There you are. Those 3 sets of 90 balloons have been released. All right. Well, let's take you to another commercial break. There's still so much more to come from SABC Stadium. Make sure that you stay tuned to Morning Live. We'll be back.